Hi everybody, Dr. Cindy here. Thought I'd take this opportunity to say hi to everybody. I've been missing seeing everybody for the past week as I've been battling my skin cancer issues. So I'd like to just thank my staff for holding down the fort at the office and Dr. Londa for filling in for me. I really appreciate that. My husband, my kids, my friends, everybody's been so supportive, so thank you very much. Appreciate it. I thought I would use this opportunity to just really tell everybody my story about how this all came to be, in hopes that you can gain some knowledge and maybe learn a few tips on how to prevent this for yourself or for a loved one. So skin cancer has been an issue for me for probably about 5 years or so, but it's been even a longer period of time when I take a look at my whole family history. With a strong Irish-German heritage, myself, my sisters, my mom, my grandpa, we've all had precancerous or cancerous areas that have needed attention over the years. About 3 years ago, I had an area on this side of my nose that was not doing so hot, and it was flaking and red and it would bleed, and I went in and had that biopsied and it came back as basal cell carcinoma. And at that time I opted to utilize Mohs technique. It's an in-clinic, in-office procedure where a local anesthetic is used and they take layer by layer of tissue cells and analyze them under the microscope. And as each layer is taken out, they go until they have a clear layer to make sure all the cancer cells are gone. So when I had that side done, they had to go 2 layers in, and then they were able to stitch that side up, and it was doing very well. Then, a year ago, I was noticing some early signs on the other side of my nose. So I had seen my dermatologist, and of course it had been flaking and bleeding and doing its thing in a kind of a cyclical way. And of course, by the time I had my appointment, it looked pretty good. So the dermatologist had looked at it and said, you know, it looks really good. I really don't want to give you a scar with the biopsy, and it's a lot of expense. Why don't we just watch it for a little bit? And I wasn't too happy, but I said, okay. Then about a year went by. So December, I went back in again because the cycle was continuing, and again, they were hesitant to do any kind of testing. And I said, you know, I really want this biopsied, and if you're not going to do it, I'll just go to another office and have it done. So they biopsied it, and sure enough, it came back as basal cell. And again, we were going to do Mohs technique, just like the right side. So I went in last Tuesday, and they started doing layer by layer, going through, and after 4 hours of finally getting to clear tissue, I ended up with the size of about 1/4 of a hole on the side of my nose that at that point was just not, it was not able to be pulled together and stitched because the gap was too big. So they sent me home, and the next day I went to St. Nick's Surgery Center, where Dr. Harold, plastic surgeon from Sheboygan, came in to see me, and they put me out, and what they did was they did a V-cut here and then swooped around the side and lifted the skin this way and basically pulled everything together. So lots of swelling, bruising. It wasn't a pretty sight for a while, but now, you know, what are we, 5 days out, it's doing much better. They said it would take probably about 6 months for the scar to diminish. I get the stitches out tomorrow. For the scar to diminish about 6 months, and for the nose to kind of drop down a little bit more on that side. Sharing this information with you I think is important so that, you know, first off, that I miss you guys and I wish I was there, but I'm really trying to get it to heal as well as it can. And having my head down and adjusting on kind of all that pressure just was not going to be too good for that. So my plan is to be back on Monday, and I'll be super excited to be back to see everyone. But I thought I could just leave a few tips for you all on ways to look at your skin and assess, do some self-assessments, and just know that I'm here to help you as well. So there's a series of letters that go together. that help you to remember ways to look at your skin and things to look for. A stands for asymmetry. Asymmetry just means that if you have a mole or a freckle, it should be equal in size all the way around. If you were to divide it in half, both sides should look exactly the same. If it's not, it's just a red flag. B stands for border, and that's what the outer rim, the outer border of your area looks like. If it's kind of rugged or notched or raggedy, those aren't very good signs. C is color. A nice uniform color throughout your area, throughout the area, is a good sign. If it becomes mottled in color or has a variety of colors, browns, tans, reds, blues, those would be not good signs. D stands for diameter. Anything bigger than a pencil eraser tip is classically a red flag. And E, evolving. Evolving just means, is it changing? Is it suddenly growing? Is the color changing? Is it crusting, bleeding, flaking, itching? All of those signs and a variety of those things all put together are signs that you really should have that assessed by a professional. There are plenty of ways to prevent skin cancer. Of course, the biggest one is just being smart and protecting your skin from UV rays. We all know that the sun is very intense, especially from 10 to 2, trying to avoid that time frame, and now they're even saying 10 to 4. So if you have stuff to do outside, whether you're mowing the grass or going for a bike ride, really try to do those at the ends of the day, either morning or early evening, where the sun is not as intense. Most damage comes from when you are a child. Up until the age of 18 is when most damage has accumulated in those cells. So protecting your skin from a very young age is key. So all the babies and little kids, keep them covered. Sunblocks, hats, protective clothing, that will all help a lot. All these tips are just really designed to help you take care of your children, take care of yourself. Say no to tanning beds, no tanning beds. Whoever said, oh, let's get a base for a little protection. That's a crock. There is no base. Any burn or tan is sun damage. So, especially for high school girls, college girls, someone who's in a wedding, tanning beds, stay away from that. And if you feel like you really need to change the skin on how it looks, go for a spray tan if you need to. But how well we take care of our skin really is key. I just want everybody to know that I'm here to help them in their health care and whatever they need help with. Of course, adjusting the spine and removing subluxation, that's my thing. But the way that all your organs are working together, all of your systems are working together, every muscle, tissue, organ, cell is controlled in a manner of the way that your nervous system works. I will always help to keep that area in line for you. And when you have things that are not working well, you can talk to me about anything. And if it's something that I am able to help you with at the office, we'll do that. If it's something that we need to refer on, we'll do that as well. So that's my story in a nutshell. And I hope that you guys are all having a wonderful week. And I'm really looking forward to seeing everyone next Monday.